Hi, my name is Brad Siff. I'm the founder and president of BioWave. I want to welcome you to our July webinar. Uh, I'm very pleased to introduce our guest lecturer this month. His name is Dr. Mark Matsunaga. He's the director of the Comprehensive Pain Center. And the title of this webinar is called What's in Your Toolbox? A Comprehensive Approach to Patient Health and Well-Being. I just want to remind you at the end of the presentation, we will have a live Q&A session, and you can submit questions there's a little Q&A icon at the bottom of your screen. You can click on that and type in your question, and we'll be happy to answer any questions that you may have. So with that, I would like to turn it over to Dr. Matsunaga.
Thank you, Brad. Pleasure to be here today. I'm excited to be able to speak a little bit on this technology with the BioWaveGO. We're looking at a comprehensive pain program which I founded many years ago, and we have focused on looking at the way that we approach pain management and how we can help people find the tools that can give them the ability to start their journey on managing their pain. The slide here shows my background. Grew up in California, moved out to the East Coast, did residency in anesthesiology. I'm so old, they didn't have pain fellowships really at that time, so I grandfathered in getting certified or board certified in pain management. Stayed here in the area in Maryland and became a member of Johns Hopkins Medicine and started my own pain management practice, the Comprehensive Pain Center. Once again, we really kind of focus on being able to provide our patients with a good understanding of their pain management, of the pain entity, and give them the data, the information, so that they can understand what they're dealing with. We put them at the front end of a tandem bike, and we try to do our best to give them the tools, the modalities, the resources, so that they can find a path for them to go down to improve their end goal, which is a good quality of life. We look at this philosophy of starting low, going slow. We try to find the best tools with the data that we have and present them with the options so that they can kind of pick their path. The patient-centered approach is really what kind of sets our practice apart from a lot of other practices. We are looking for finding ways that the patient can improve their quality of life. We put them at the front and basically give them the options of the tools, but basically are asking them, what can we do to help you manage your pain? We don't focus on what your pain score is. We focus on, are you able to do what you want to do on a daily basis and work on those goals? So we came up with this concept of a toolbox because I think it's very fitting for the business that we're in here with pain management. One of the useful tools that we have in pain management and that anyone can really kind of be offered is using transcutaneous electrical nerve stimulation, using electricity to stimulate the skin surface, let those waveforms of electricity penetrate deep enough that it uses what they call the gate control theory. It uses the ability for the brain to be kind of confused and feel an electrical current instead of the pain. And it can be very effective because it's non-invasive. It can be used almost anywhere on the body. There are some exceptions about not using it across the heart or on the carotids, but essentially it can be used pretty much anywhere. And the idea of masking the pain using this gate control theory is very beneficial for acute pain and now more for chronic pain, because the newer technology that nowadays can be very beneficial. I'll explain the reason why. But it can help all kinds of different disease entities, and the several different manufacturers of these electrical stimulation devices have come out. I did a little review on Google and just typed in the electrical stimulation, and all these different manufacturers came up. I was kind of surprised. I've never heard of several of them, but it shows you that this market of using electricity, because it's so conservative, because it's so available, is a wonderful, wonderful tool for people to have access to. Now, the difference in the BioWaveGO technology that is used here or described here is unique in that for several reasons, but unique in the fact that the electrical stimulation, the 30-minute treatment that's available with this device, penetrates a little deeper. It helps with other things like circulation. It helps relieve spasms because of the ability for it to be so easy to use. It could be used many times a day. It's not like getting a shot. It's not like taking pills. It's a very easily used device and has been proven to be very clinically effective. And what sets the BioWave apart from these other TENS units, multiple TENS units on the market, is that the technology with the waveform actually creates a little dome of numbness that can last up to 8 hours after you use the device. And that's not like the traditional TENS units, which work great while they're on, you take it off, and it kind of wears off within seconds or minutes. This device can have prolonged relief, and it's used a lot by different professional organizations like the professional sports teams, and it's used by the VA hospice system and workers' comp. So the data is out there to justify or prove the efficacy of this device. And one of the other advantages of the BioWave over the traditional TENS units, because of the prolonged effects that it may have, it's very effective with neuropathic pains. And we all understand that neuropathic pains are uncomfortable because of the burning, the tingling, the buzzing sensation. However, with this device, it actually masks those pains while it's on. You trade one buzzing for another, but it has the pain relieving effects for several hours after the usage. So it's a very beneficial device with the technology, with this unique waveform of the BioWaveGO. Comparing the BioWaveGO with the traditional TENS, like we said, the major differences, they both use electricity, they both penetrate through the skin. The depth is a little bit different with the BioWaveGO, but mostly it's the impact that it has to create this little numbness area that can last for up to 8 hours after a treatment. And that kind of technology is amazing because there's no other unit on the market that's available like this that can provide that kind of long-term relief that's currently available for the public to use like this. When we have a patient who comes in who is a good candidate for this technology using this BioWaveGO, we look at the pain pattern, we look at the pain intensity, we look at the location, and in our practice, if they say, yeah, I've used a TENS unit and it helps when it's on, but it doesn't last that long, so I don't use it very much, those are the good candidates that can use this device of BioWaveGO. The use of the BioWaveGO to get that prolonged relief, if they do that, we put them through a little trial. We have a unit in our office and we hook them up, 30-minute trial. They control the intensity and they see at that 30 minutes is up, is this helpful or not? Did the pain relief last or not? And if it does, well, we go through and we either have them do more treatments with that device and or they can purchase their unit on their own. There are multiple cases that we've had and shown this kind of success. I don't think that there's any definitive, this is the patient that we have to use it on. There's no, this is against the pain, this is what will not work on. But I think anyone with any kind of focal pain where a TENS unit has been shown to be beneficial, this BioWave can be used. I have a couple of case studies here. One is for someone who has knee pain, very active young individual, doesn't like to be on medicines, has tried some of the conservative stuff, and then we can potentially be a good candidate try the BioWaveGO. We undergo a trial. We see that there's some benefit, and the bottom line ending up being that we can provide this gentleman with prolonged pain relief. What are the advantages of that? Well, we have the huge advantages of being able to learn how to manage the pain. We have another tool in this gentleman's toolbox that he can use anytime he wants, mask the pain, and proceed with his day. And being able to understand where the pain is coming from, understanding where, when it's appropriate that he should mask it, as opposed to masking a pain that is not appropriate to mask, but we should be treating, we should be working up, we should be evaluating, because we don't want to mask a pain that can be get it worse and more harmful down the road. This being a non-pharmacological intervention, multiple people are able to wean down on their medications. They're able to take less of the opioids. They're able to spread them out, take less doses of whatever. They find that the medication requirements to manage the pain is not as significant as without using this tool. The ability for the polypharmacy can also be honed down to taking less of the different types of medications, the muscle relaxers, the anti-inflammatories, anticonvulsants. The bottom line of, are you able to do what you need to do on a daily basis easier? Is your quality of life better? And that's the excellent thing about this tool, is that it's a great tool in the toolbox to have to offer to our patients. An example of another patient that we had with use of this electrical stimulation could be someone with shoulder pain, and the same type of impact of being debilitated, has had a shoulder replacement and not being offered any more interventional stuff, but has this shoulder that just does not allow her to function. She's losing strength. She's losing range of motion. The medications are very difficult for her to tolerate. So again, we get down to okay, there's nothing else we can do. Masking it is a very appropriate thing to do, because there's really no more interventions that anyone's offering. Masking it is not harming her safety, but hopefully will allow her to return to a better quality of life, gain some strength, gain some function, range of motion. So doing a trial on her, again, was successful, and she ended up purchasing a unit, and voila, use of medicines were decreased. The increase in range of motion, increased strength, better sleep patterns, less depression side effects of being in constant pain all the time, increasing her time with her family, increasing her time with her social activities. A lot of benefits to manage the pain, not just deal with it, not just be a victim of a shoulder replacement, having the pain and getting weaker and weaker over time, but being able to manage it. And that's the wonderful tool of the BioWaveGO. Lots of different etiologies for pain. It can be basically, like we said, used anywhere except for across the heart and on the carotids. But it's low back pain. It's the diabetic polyneuropathy, the trigger points, post-operative pains. It can be used very useful for helping people stay away from having to take medications. The surgical joints, the tendinitis, the bursitis, the pelvic floor pains, the fractures, plantar fasciitis, and the inflammatory process, anything that's fairly localized, this is a wonderful tool that you can try. Is it going to work 100% of the time? No. Is it going to work the majority of the time? Probably. And because of that high rate of success, I think it's a wonderful tool for all of us to put into our toolbox. I think that we have the responsibility as pain practitioners to be able to address individually, where is this pain coming from? What are the tools that we could utilize to try to help manage the pain and not be a victim and just deal with the pain? Okay, I'll fight through it. Okay, I'll struggle. I'll get through the day. Why do that when you have tools that you can manage it? And this being one of the optimal tools that we have that's non-invasive, it's non-pharmacological, it can be used several times a day as needed. It's just a good tool to have in your toolbox. So I would definitely recommend researching this tool. this device, this technology, and being able to offer it to our patients is a wonderful way to go.
Thank you very much. It was a great presentation. First question I have here is there more to BioWaveGO than the gate control theory?
Yes, I think that. Thank you for having me. But yes, I think there is quite a bit difference between how we use the traditional TENS units and how we utilize the technology with the BioWave Go. The traditional TENS unit, we use it's called the gate control theory, where the brain just kind of gets confused to feel the tingling from the electrical stimulation, and it confuses the brain to feel that, and it kind of masks the pain that is being perceived. With the BioWave unit, it does that while it's on, but the big benefit is after the treatment of the BioWave Go, you get this prolonged relief and reports up to 8 hours after a 30-minute treatment. And that kind of benefit is markedly great. You no longer have the gate control theory, but there's the inherent whatever physiologically is going on neurologically to decrease the signals of pain to the brain, which make it the pain relief last for much longer.
We refer to that as frequency conduction block theory, in that this BioWave tends to act more like an anesthetic, like a lidocaine, for example, or Novocaine, in that you do get this light numbness for a period of time following the treatment and ongoing pain relief for up typically around 8 hours following a 30-minute treatment. The next question I have here is it necessary to wet the skin before using BioWaveGO? Let me take a quick shot at that, and then if you have any other comment with respect to that, we highly recommend that you clean your skin with a damp washcloth prior to applying the electrodes to take off dead skin cells, to remove lotion. If there's a lot of hair, you should shave the hair first, because we want the hydrogel on the electrode to have good contact and get into the pores of the skin, and that makes it very easy for the electrical signals to pass through into deep tissue. So you don't need to wet the skin, but if you clean it with a washcloth to take off that, and the skin can be dry, it doesn't have to be wet. But that's what we would typically recommend. I don't know, Dr. Matsunaga, if you want to add anything else to that.
Yeah, I would agree. And reusing the same pads over and over several times, and there are some tricks of the trade to kind of reuse them a little more frequently by doing some little techniques to keep them going. But definitely the contact on the skin is the most important.
If you keep your skin clean, the pads will last much longer. Next question is, does it work better than medications?
That's a very difficult question to have a specific answer to. We're working with two different mechanisms of masking pain. The medications mask the pain through pharmacological means, where this is a non-invasive electrical stimulation, which are actually going directly towards the nerve fibers, sending the signal to the brain as pain. So that's a totally different mechanism, pharmacologically versus non-pharmacologically.
Next question is, how deep through the tissues can the BioWaveGO work?
I think that's a real individualized question. And I think depending on the source of the pain, in our practice, we kind of use the regular TENS units to kind of test, is the waveform penetrating deep enough to confuse the pain source or not? Oftentimes when it does, then we think that the BioWave is going to have some benefit, but there's several centimeters that penetration can get. So you can get through the shoulder, through the knees, into the hip. I don't think it penetrates deeper like into the abdominal structures, but I think you can definitely get most of the superficial structures on the body.
You speak of the abdominal structures. I would just mention that we get very good results using BioWave to manage pain from menstrual cramps, as an example. So it seems to work very, very well for that. And other pelvic floor pain applications like interstitial cystitis, pain from interstitial cystitis, as an example. I have another question here. Can this treatment be used in combination with other therapeutic interventions such as trigger point injections? And why don't you go ahead and answer that?
I think they're both wonderful tools, and I think that both can be utilized, and there's no problem with using them at the same time. I think the wonderful thing about using electrical stimulation is it's non-invasive. You don't have to get stuck with needles, and you potentially can get the similar types of results because the BioWaveGO has that ability to take care of that localized muscular pain.
Thank you. And I would completely agree. Um, the next question we have is, will it help with inflammation?
Inflammation can be helped mostly because we are trying to, well, it's been shown that the increase in circulation occurs with the BioWave device, and getting rid of all the bad molecules and putting all the good molecules into that area is definitely an advantage. It is used to help with the inflammatory response. So yes, it can help with inflammation.
So there is an increase in blood flow, and so actually there was another question: is will it help with healing? And basically, if the increase in blood flow, which is in the volume of tissue beneath each of the electrodes, um, can be beneficial for your particular pain condition, then not from one treatment, but with multiple treatments over weeks, or a month or more. Can have a cumulative benefit and provide a potential healing effect for that particular patient. Here's another question. Why does the pain come back with a vengeance after the 8 hours of pain relief?
That's a interesting question, and it's not uncommon that people will often complain of more pain after they haven't experienced it for quite some time. It's a little unclear if there's actually a physiological or anatomical reason why that happens, but it's not an uncommon complaint. It could be just that the brain got used to having no pain, and it almost has to reset its tolerance to that kind of pain after a while. But I can't explain why there's a handful of people, not definitely not the majority, but there's definitely handfuls of people who experience the increase in pain after the pain has disappeared for quite some time. It's like the local anesthetic wearing off, and then all of a sudden it's extreme pain. Did the local anesthetic cause that, or is it just the brain's confusion of it not being there for a while and then it returning?
I would also add that, if a patient's not in pain, they may do activity that re-aggravates whatever their prior pain condition was. So when the effect of the pain relief does wear off, they may have re-aggravated it as a result of doing certain activities that could cause it to, that could re-aggravate it. So that may be another possible reason. I have a few more questions that keep coming, and I thank you everyone for sending in the questions. If the pain is from muscle spasms slash knots, will the BioWave Go relieve the pain and actually relieve the source of the pain, meaning the spasms, or will they still be there and one needs to see a physiotherapist?
It's a good question. I think that our knowledge, current medical knowledge of why people get cramps, and we accuse electrolyte deficiencies, we accuse dehydration, we accuse overuse, misuse, damage to the muscle fibers, all kinds of reasons why people get these what we call trigger points or muscle spasms. The big goal at that point is to relieve that spasm. There are muscle stimulators that you use that fatigue the muscles. There are corrections with dietary supplements, hydration, injecting the trigger points. All are potential ways that you can get some muscle relaxation and potentially because of the spasm, because of the pain that's caused, because the spasm gets relieved. Sometimes it's the pain that causes a spasm. So taking care of the pain can relieve the spasm. That's a very common scenario around joints that people will spaz around the joint to protect the joints. Whatever the reason, I don't think it's unreasonable to think that if we can manage the pain, give the body a chance to relax the muscles, that maybe the spasms don't return. So it is a tool that we have to try to help decrease the spasm pain and potentially the spasms.
I would add that in our experience, the location of the, say, a trigger point, like in the trap, can feel very hard and tight to the touch. And when we treat directly over that location post-treatment, that tissue will feel much softer to the touch. There's a very noticeable difference in the way the tissue feels. So, BioWave definitely has a direct effect on reducing the spasm, as well as the pain.
Yeah, increasing the circulation, getting rid of all the
Exactly.
bad stuff, bringing in the good stuff can all help.
And the next question is, how many 30-minute treatments can I do in a day?
My awareness is there's no limitation. If it helps, that you can repeat it. And it all depends on your individual circumstance of how long you think that you're getting the pain relief that you want. I think that it could be used on different body parts over and over at different times. I don't think there's any kind of restrictions because I don't think there is a restriction on the use of the BioWave units. So it's very individual. It's patient selection. It's you helping the patient find if this tool is going to be appropriate for them and use it as much as you need to get the comfort and the satisfaction of the pain relief that you're looking for.
Does it work for the specific source of pain uh, that needs to be done? Essentially, if the source of pain is muscular versus neuropathic, would there be a difference in your recommendation for using BioWave?
BioWave is not correcting any anatomical disorders. It's not fixing cartilage. It's not repairing tendons. It's helping circulations, which may assist in those types of healing processes, but it's not doing anything to correct the anatomy. It's a superficial stimulation of electricity, which is confusing and masking and creating a scenario with that localized area that can promote the uh, uh, function of that little area. But there's no anatomical changes per se. Uh, Over time, yes, I think the increased circulation can help with all these things with kind of helping change anatomy, but there's no immediate result that you're going to get with a treatment with this BioWaveGO.
I would add that it almost doesn't matter what's causing the pain, as long as the active electrical field that's formed beneath each of the two electrodes can encompass the pain nerves that are conducting the pain signals to the brain, then there's a high probability that BioWave can have an effect. So BioWave can treat both nociceptive pain, like from a traumatic injury, or neuropathic pain where there may be some nerve damage. Where can I use the BioWave Go device?
It's essentially indicated for almost anywhere in the body, and the contraindications I'm aware of is over any open wounds. You don't want any skin lesions underneath it. You should not use it around the heart or pacemakers. You should not use it on the carotids. But essentially, I think we basically can use it over bones, joints, muscles, anywhere that is indicated where there's a pain source that is localized enough that these electrical stimulation waveforms can get to that area.
Next question is, what are the side effects?
Basically, nothing. It's time to take it, to do it. But the incidence of other types of side effects that you would get from any kind of medication regimen are out there, the nausea or sedation or things like that. It's just a very superficial 30-minute treatment using electricity. A little area gets involved. Post pain is very, very, very unusual. I don't think I've ever had anyone say it hurt more after using with this device. Um, so really, I think it's a really non-invasive, minimal to no side effect modality, a good tool to put in your toolbox.
I would add one of the key things is the electrodes cannot touch each other. The minimum spacing is 1 inch between the edges of the electrodes. If they do touch, you can get a burn. So that's the one very important thing that patients should know. Um, so here's another question. Other than cleaning with saline, what other tricks are there to prolong use of pads?
The biggest thing that I'm aware of is just make sure that you're not having any oily skin or dirt or the excess skin underneath it where the pads lose their conductivity and connection to it. But I don't think it's recommended at all to be adding your own lubricant or anything like that to the pads.
There's another question here. Can one switch to regular electrodes that are available locally? If you don't mind, I'd prefer to answer that question. Um, the only electrodes that are approved to be used with BioWave devices are BioWave electrodes. There's a proprietary connector, so using a regular Chinese electrode that you might buy for a lower cost, it actually won't connect to the device. The device won't work with it. Our electrodes use a thicker hydrogel. Our electrodes also have a silver carbon layer so that the electrical field is dispersed evenly across the entire surface of the electrode. So you're getting a much better treatment. You're getting the ability for the signals to pass through the skin into deeper tissue much more effectively. So please don't use third-party electrodes or try to use third-party electrodes with the device, separate from the fact that they won't work because of the connection scheme. Finally, last question, how can I get one?
I know that Amazon at the present time does sell these units. In my practice, we have some units that we can get to our patients, and I think one of the biggest drawbacks is that it's still a little expensive, and is one reason why our practice offers these trials before we purchase them.
So I have to add that today is Amazon Prime Day, as is tomorrow, and we do have a special on Amazon. And the BioWaveGO units are $100 off both today and tomorrow. So if anyone is interested in getting one, it is a good time to try it. We do have a 30-day money-back guarantee. You'll know right away as you turn up the intensity the first day you use it whether this is really going to help you or not. Anyway, that's all we've got. I want to thank everybody for their time and for providing the questions. And Dr. Matsunaga, thank you very, very much for your time as well.
My pleasure.